Updated Virginia Certified Nurse Aide CNA Exam 2026 Real 40 Questions Answers. Question 1. When a resident is on NTO status, they can have water only, ice chips only, nothing by mouth, clear liquids. NPVO means nothing by mouth. Question 2. What is the golden rule of charting? Only chart at the end of shift. If it wasn't charted, it wasn't done. Use pencil. Include your opinions. Legal documentation standard. Question 3. A resident refuses a bath. You should force them, respect their refusal and report it. Call their family, tell them they smell. Residents have the right to refuse treatment. Question 4. What is the normal oral temperature? 96.6 F, 98.6 F, 100.2 F, 97.0 F. 98.6 F is average. Question 5. A resident is in isolation. What is done with their linens? Double bag them, wash in the sink, throw them away, shake them out. Double bagging or special handling per facility policy. Question 6. Which of these is subjective data? Blood pressure, weight, resident's report of pain, pulse. Subjective is what the resident says. Question 7. How should you identify a resident? Ask their roommate, check their room number, check their ID band, call them by name. ID band is the standard identifier. Question 8. A resident wants to complain about care. You should tell them to be quiet, inform the nurse or ombudsman, ignore them, tell them they are wrong. Residents have a right to voice grievances. Question 9. Which of these is a sign of skin breakdown? Redness that doesn't go away, tan skin, dry skin, freckles. Non-blanchable erythema is a stage 1 pressure injury sign. Question 10. How often should a resident be repositioned? Every 4 hours, once a shift, every 2 hours, once a day. Standard is every 2 hours to prevent pressure sores. Question 11. A resident falls. What is your first action? Help them up, call for a nurse, move them to bed, give them water. The nurse must assess for injury before moving the resident. Question 12. What is the best way to prevent the spread of infection? Wearing gloves, wearing a mask, hand washing, using antibiotics. Hand washing is the #1 way to prevent infection spread. Question 13. A resident is choking and cannot speak. What should you do? Wait for help, perform abdominal thrusts, offer water, hit their back. Abdominal thrusts Heimlich for complete obstruction. Question 14. The normal adult pulse rate is 40-60 bpm, 60-100 bpm, 100-120 bpm, 50-90 bpm. 60-100 bpm is the normal range. Question 15. Which position is best for resident having trouble breathing? Prone, supine, Fowler's, Sims. Fowler's upright aids lung expansion. Question 16. Postmortem care is for before surgery, after death, after birth, during sleep. Care given to a body after death. Question 17. Standard precautions should be used for only HIV patients, all patients, only MRSA patients, patients with coughs. Standard precautions apply to all patients regardless of diagnosis. Question 18. When feeding a resident, you should rush them, offer small bites and wait, use a straw for everything, talk to other staff. Prevents choking and promotes dignity. Question 19. When dressing a resident with weakness on one side, dress weak side first, dress strong side first, dress both at once. It doesn't matter. Dress weak DAW, and dress strong. Question 20. What is the first step when discovering a fire? Rescue residents, activate alarm, contain fire, extinguish. Race protocol starts with rescue.